Hello, everyone. I am so happy to do this today. I hope everyone can hear me. We are going to be talking about POTS today, and we'll be discussing inflammatory POTS and aspects of POTS I think that often get ignored. We are rebelling against traditional treatment of POTS, which usually will make patients worse, and talking about how underlying problems driving POTS can be identified and ultimately patients can recover. So I imagine there's quite a group out here. Some people know my story and others may not know my story, but I was disabled by POTS for 10 years. My kids were sick. My son got sick when he was 8 years old and missed 3 years of school, was incredibly ill, developed severe osteoporosis, broke his arm just throwing a ball, putting on his coat. And even though we went to every doctor in the US for this and participated in clinical trials for years, he and I were unable to function. My daughter was able to stay in school. We were told that no one knew the cause and that likely we were normal, just more aware of our own body. So this has been quite the journey in getting answers and then expanding it to everybody's different. We were able to recover once we got the information we needed, but how can we help many others? And that involved quite a bit of research. So here we are, a little over 15 years later, helping other people at POTS Care. We really want to share more of what we know. So that's what we'll be doing today. First, what is POTS? Postural orthostatic tachycardia syndrome. I think it's a terrible name for a condition that involves so much more than the heart. If you talk to physicians outside this arena and you say POTS, they're going to say, that's a heart problem, right? And most people, it's not. And I think most patients out there experience, like I did, where we would go to cardiologists, hearts racing, especially when we're vertical, and the structure of the heart looks fine. We might have PVCs or something, but basically they say the heart is fine, and then they don't know what to do. About the only options we're given is to slow down the heart. And my question was, why is it going so fast? I got a virus overseas, and weeks later, my heart's racing like this. And I have these other symptoms that are starting to occur and multiply. And I remember my cardiologist saying, well, we don't know why your heart's going so fast. And I said, okay, could you give me a list of things that could cause a fast heart rate in a healthy, otherwise structurally sound heart, that those could be investigated? And they said, no, we don't know what could cause that. I thought, why not? If you're a cardiologist, aren't you taught like what would make the heart go faster? It was incredibly frustrating. So, and I imagine quite a few of you are experiencing that too. So if we could move beyond the name of POTS as our illness, POTS is just a presentation. It is not the underlying illness. Something always causes POTS. And I think for most of us with invisible illnesses, if you will, that involves POTS, our ultimate diagnosis is whatever caused POTS to occur. That's not the trigger for POTS. Like COVID, we're seeing a lot of post-COVID, for example. I got a virus, trauma, what have you. The trigger is not the cause. The cause is the abnormal response of the body to that trigger. And that's where everybody's different. So here at POTS Care, what do? We pick all these apart and know that although my story was so horrible, I want to make sure everybody knows I am fully recovered. I fully recovered a decade ago, as did my kids, lead perfectly normal lives. There is a happy ending to a very, very, very difficult story. So when you're faced with a condition that you know something terrible just happened, your body is just breaking down in so many ways, and you're told the testing is normal, they're not looking in the right places, clearly. Okay, they're missing something. So POTS, if it's not a cardiac problem, and it's good to have that checked out, make sure your heart's okay, because that would be relatively easy to address in most people. Then it's important to know if it's a sign of a neurological disease, something like ALS, Parkinson's, Lou Gehrig's disease, some neurodegenerative condition can start with POTS. That is fairly easy to rule out too. A neurologist can help with that if you need it. But I will tell you, the patients who have neurodegenerative conditions that display with POTS move past POTS very quickly to motor dysfunction and other issues. The POTS is the least of their worries. So although it needs to be considered, don't hang out on that possibility too long. If that's not what it is, move on. And then the next thing we look at is it an inflammatory process affecting the cardiovascular system? And if so, what is that? I think for a long time, probably a couple decades, excuse me, researchers were looking for an autoimmune condition affecting the neurology of the blood vessels, preventing us from being able to constrict properly and maintain blood flow. And yet they basically came up empty-handed, certainly for the majority of patients. So we can run into trouble if we continue to look for this rare autoimmune condition affecting the neurology of blood vessels. Do know that. We need to move past that. We do see some autoimmune conditions, but those are not the cause of POTS, because if so, everyone with autoimmune conditions would have POTS. That is not the case. So it's important to pick that apart. So we've had POTS Care up and running now for about 8.5 years. We look for the patterns to help get us started. We look at signs and symptoms. We're doing a lot of blood work. But in the diagnosis of POTS, if you think of it again as it's a presentation, it makes the official diagnosis on a tilt table test of 30 beats or more in 10 minutes of tilt, or over 120 beats per minute on a tilt in 10 minutes, less important as the patterns that are exhibited by patients. So sometimes it's hard to get a tilt table test. And my thinking on this is, okay, if the artificial or arbitrary criteria for POTS is the heart rate must go up 30 beats a minute on a tilt table, okay, does that mean then if a patient's heart rate goes up 29 beats a minute, it's not POTS? And usually the specialist will say, well, that's probably still POTS. Okay, so if it goes up 28 beats a minute, that's not POTS. And they go, well, okay. And you might get what I'm kind of leading to is, shouldn't we be looking instead at the tendency to develop a fast heart rate upon standing or being vertical, along with a pattern that can involve other systems of the body, and telling us that this could be a systemic problem that is manifesting in the cardiovascular system, certainly, but it's also manifesting in other ways too. Okay, and that's why when we have inflammatory POTS, throw that name out there, we're sick from head to toe. I remember telling the doctors, can you just ignore the heart rate? I know it's going really fast, but I am so sick. If we ignore that, could you figure out what's happening to the rest of the body? And they said, no, because you have a diagnosis of POTS. So part of the goals we have is to change that label ultimately to whatever underlying process is occurring in each case that ultimately can result in the presentation of POTS. Until then, that's what we have to work with. So we encourage people not to get too hung up on the artificial or the arbitrary criteria for POTS, but instead to look at patterns. And that's part of what we do here at POTS Care. So we are a team that's doing the brain work. And the vast majority of patients that we see have already seen a gazillion doctors. I know I went to over 50, my first 3 years. It wasn't like I lacked for somebody to listen to my heart rate, make sure my heart was okay. I saw every specialist there was, neurologists, GI doctors. Oh, list goes on and on. But we're here to take a look at the entire picture in each case and put it all together. What are some of the major problems that led to an illness? What are more secondary issues that occurred? And then all of the dominoes that have fallen, how could we start to pick those up? And is there anything that's keeping someone stuck in certain aspects? Because we all are somewhat different. So we do a lot of brain work here. But what was very important to me when we set up POTS Care was that I didn't want people to have to be dependent upon us for the rest of their lives to be able to understand how to take care of their condition. Not POTS, that can go away, but the underlying problem that led to POTS, how can they take care of that? How can they manage it so well that they're not necessarily even a sick person? Like, I'm always a patient, but I'm not sick. And I am probably the most active person I know. I think for many patients, that's an achievable goal. Okay. So when we start with a patient, we look at the old records to make sure, see what's been looked into, see what may have been missed. We look at it from a completely different angle in many cases and do custom blood work. We like to look inside the eyes or get images, visual fields, because that's where I started with this. And I thought something doesn't look right in most of these patients. So we dig deeply in each case and hold patients' hands once we've laid out a complete treatment plan in teaching them what all that means, make sure they're pointed in the right direction, that they can ultimately get to the point to graduate from us. Okay. And that was important for my kids because they were going to college. I didn't want them to have to call me every week. What do I do now? So I taught them, they took control, ended up doing beautifully, and then ultimately needed little or no medication unless something gets riled up, and then we know what to do. So we are the authorities on inflammatory POTS here. And it's interesting because I threw out that term a few years ago, and it was met with much disdain from the majority of the medical community, saying there is no such thing as inflammatory POTS. I thought, you just wait, you're going to see. Okay. And then COVID came along, and they're starting to understand the concept of how some chronic inflammation elements, genetic or what have you, that COVID even can stir up, can ultimately affect the cardiovascular system, but it can affect more than that. So inflammatory POTS is something I think patients understand perhaps even better than practitioners do, because we feel it. I know I felt inflamed when I was a patient, and I couldn't put my finger on it. I remember taking ibuprofen most days, and I thought, why am I doing this? I don't know. And then I put a pillow behind me in the back of the car, or in the car behind my back, and a friend said, why is there a pillow there? So I don't know that either. I just feel inflamed. And so I think as patients, we kind of get it. But what doctors recognize is, say, if we get the flu, for example, or if anybody gets the flu, there's a tendency to develop tachycardia, and it's an inflammatory response of the heart. So the concept is understood. It just needs to be broadened to other areas of inflammation. So we love taking cases top to bottom. Okay. If we can't do that for any reason, including financial, logistical, what have you, I came up with a POTS Care package to start to introduce the concept of inflammatory POTS, how it can affect the cardiovascular system, including damaging the vascular endothelium, the inner lining of the blood vessels causing us problems. And that was something I could actually see in the blood vessels of the eyes. And then ultimately, part of what I needed, my kids needed, other people needed, was help with what looked like vagus nerve problems. It wasn't a vagus nerve problem after all, but workarounds for some of that too. So I thought I'd show you the POTS Care package. I think I can do this. It's a little awkward with the camera. This is what it looks like. And I do like this box. I will tell you, I think it's great. This is, you open it up and there I am. I got all this tissue paper, but it is big. Okay. There's a POTS Care package bag. Pull this out. And there's cards that kind of talk you through it. So sometimes it's hard to know, what do I do first? Okay. So I wrote these out for you to guide. There's an app that comes with it, and it describes what you do with this app, the workbook, et cetera, et cetera. So the cards are helpful. And then there's heart rate variability, which will come with an app also. Heart rate variability is one measure of the parasympathetic nervous system, and the vast majority, if I almost want to say all, I feel like that's wrong to say all, but most of us have a dramatically reduced parasympathetic nervous system and a dramatically raised sympathetic nervous system. I wouldn't bother with heart rate variability when you first get started because it's going to show crazy. But as you start to recover, then it's kind of nice to monitor that. We got socks because I think everybody needs to be comfortable. There's a little journal workbook, and know that lack of exercise is not the cause for POTS. I find that almost insulting. When I went to Mayo Clinic at first, I was so sick. They were doing their physical and they said, "Hey, you've got some really great calf muscles." And I said, "Would you make a note on the record? I'm not deconditioned. I work out every day. That I know that's where you guys are going to go." And then nutrition was kind of a hobby of mine. I always ate well. And don't tell me to change my diet. That was not the cause either. I got a virus. Something happened to me from that virus. Okay. Having said that, the sicker we get and the more couch and bedridden I got, then deconditioning did play into it. And then my eating went, healthy eating went out the window. So this kind of helps get back to paying attention to that when you feel better and getting back to a normal sleep cycle. And then the rest are supplements in here. There's $500 worth of supplements that didn't exist when I went through this illness. And I'm in my kitchen putting things together that we needed to recover. And although I never wanted to get into the supplement business, when I was able to recover only because of them, and it was new science, I decided to go ahead and put those out to the world. So I have 4 patents so far. This is a new area of science. So with POTS Care, we're expanding our opportunities to work with you too. Beyond full treatment, the POTS Care package, there's a consult option, which is not medical. We can't examine you, go through all the medical care for that, but we can talk on a high level. And then we're about to add a case evaluation for some people have a medical team who would like to be guided. That does happen. And if so, we can look through the records and give some advice on the next things that they could look at. So we'll have some changes to the website soon. Look for that. I wanted to mention just a couple things, and then I'm going to look at your questions because I know there's some great ones. Our inflammatory POTS patients are to the point where the inflammation is systemic. There are changes to the brain, including inflammation and oxidation. and it drives very high levels of anxiety. And it can exhibit as anxiety, but it can also exhibit as kind of an overachievement, attention to detail, almost an OCD type concern to have things a certain way. We have a very high bar for other people. We expect other people to reach that bar or exceed it, and people just oftentimes can't do that. We become difficult to live with, for one, difficult to work with. Um, and then it can get bad enough, we're afraid of everything. We're afraid of leaving our home. We've seen agoraphobia. I could not even make a phone call. It was too stressful. I couldn't order a pizza. There is no way I could have had a normal conversation with someone unless I knew exactly what we were going to talk about and the situation was perfect. And then the hardest thing we see at PodScare is patients whose anxiety has gotten so bad that they are afraid of the very medication or supplements that can pull them out of it. I would implore you, don't let it get that bad, okay? And know that if you're going through that, one, it's horrible, been through it, and two, there is always a way out, okay? But that is across the board. And I think some of the research centers dealing with autonomic dysfunction have come to the conclusion that POTS patients are just nuts because we exhibit that anxiety to them. And we do have symptoms throughout our body that they don't understand, and we're highly anxious. So I understand how we can be misdiagnosed as psych patients, or we see a lot on the autistic spectrum because of those symptoms. I was very resistant to that. I knew I didn't suddenly have a psychiatric condition. And I knew my 8-year-old son, didn't suddenly have a psychiatric condition. So the other thing I wanted to mention is we're going to be releasing more and more of this, but we see a lot of inflammatory patients who are told this must be mast cell activation syndrome. And I understand why they say that, because we exhibit just like it. But testing for that is objective, and it's not as hard as it sometimes is made out to be. There are many mimickers of mast cell activation. We see many more mimickers than we do true mast cell activation. So if you're working through that, know that if your testing is negative, like if tryptase is negative, keep your minds open to the possibility that sure, mast cells might be getting caught up in something, but that may not be the true underlying problem. It could be a secondary issue. And if you focus only on that, it could limit your recovery. Okay. I think I've covered most of my high points. Always a reason for PODS, right? Always. And when that reason is determined, then the discussion of recovery can occur. What is this? What are we dealing with? And what else is happening in the body? And everybody is different. And don't ever give up. You might not have your answers today, okay? But there are answers. And it was so hard to get every layer figured out in my case, in my family's case, and my kids and I were different. But please don't ever give up. I think the lack of validation for what POTS patients go through is such a horrendous part of the illness. And the battles I would have with doctors, either I would leave their offices crying or furious, are not unusual because they don't understand a lot of chronic inflammatory conditions. They will, but it's fairly new in science. So don't give up. Something's driving your illness. Okay. I feel like we should look at some of these questions. There's a lot of them. Let's see. Which one do I want to look at? And thank you for all the kind words. There's so many people thanking me for my work, and I appreciate that so much. It is quite the journey, and you guys know POTS patients are the sickest patients ever. But the empathy I feel for a patient's journey never goes away because it was so horrible for our family. So yeah, it isn't just all altruistic. I feel a need to change that for people. So Thank you for that. Um, there's a long COVID patient. We are seeing more and more of that. And I think it's fairly well understood, even in the general community, that the virus itself in long COVID patients is basically gone. It's not a viral problem, it's that body's abnormal inflammatory response to it. And that's why if you end up really sick in the hospital, what have you, you might do well with dexamethasone IV, a steroid, bring down that inflammation, and then get the help to see what kind of inflammatory response did you experience. So that way, the next virus or whatever trigger could get you is not going to, again, set you up for starting over. This warrants probably a discussion. I know in my recovery, I got so sick. Okay. And you don't have to get as sick as I do to be able to figure out your condition. But the sicker I got, the easier it was to see things, I will say. But the crawl out of it was a real beast. And working my way through that, I think, was so discouraging because of the lack of validation for that. Okay, someday we'll have different labels, and that won't matter so much. And COVID is actually helping us with some of that. Okay, so hang in there. The question of, I get dizzy just standing in the shower, is that POTS related? Likely. I think almost all POTS patients relate to that, where if you stand up in the shower, the warmth from the water causes some vasodilation. Your blood vessels are already affected. And then the blood tends to pool. It goes south. If you look down, you can probably see your feet are purple. Okay. So be real careful in the shower. I resisted getting a shower chair for the longest time because it represented disability to me, but ultimately did, and it allowed me to shower. But if you take a bath, the same thing can happen, and you won't know it's happening until you stand up. So be real careful getting out of a bathtub. IIH. Do all POTS patients have IIH? This is someone who's seen some of my stuff. If you don't have a copy of the Driscoll Theory, let us know. We'll shoot it over to you. That book is 8 years old, but it's still brand new for most people. The first thing that was released was that in POTS patients, there's a tendency to develop idiopathic intracranial hypertension, meaning there isn't a physical obstruction of the flow of cerebral spinal fluid around the brain, but that is always driven by inflammation. And if that is occurring, you need to bring that pressure down. And many patients will feel the strength to go on at that point. It was so horrible for me and my kids, I know. So do all patients have IIH? No. The majority do. And we did have 2 patients at POTS Care that when we saw them, they didn't have high pressure. They didn't have symptoms of it, signs of it. They're good. But they were inflammatory patients. And at some point the next year, something triggered their inflammation, and both of them ended up in the hospital with high intracranial pressure. And it was a horrible time for both of them. And I thought, no one is leaving POTS Care without learning that this is a possibility and what to do about it. Okay. So for those of you dealing with pain at the base of the skull with the tight muscles going down the neck to the tops of the shoulders, it's one of the first things we look for. And then insomnia tends to be a problem. Brain fog tends to be a problem. And one of the probably weirdest symptoms for me was, and for many patients, was you're so exhausted at the end of the day and you go to lay down, and you lay down, your pressure starts to build. We don't drain cerebrospinal fluid as well in that position. And we're trying to go to sleep, which is already hard with idiopathic intracranial hypertension because it activates that fight or flight. But you're managing, you're laying there, you're trying to head off into dreamland. And the closer you get to crossing over into sleep, the higher the anxiety level goes. And then we just have to get up. And then we pace around or something. And kind of comes back down again. Okay, I'm going to go back to bed and lay back down, and it starts creeping up again. We look like we are schizophrenic or something. And keep in mind that if that is happening to you, you need to have high intracranial pressure ruled out. And it's very hard to do that. Somebody else was asking, how do I know if I have IIH? Is that something my doctor can test for? Oh, this is so horrible. What some doctors like to do is do a lumbar puncture. I'm not going to recommend that. Not for high intracranial pressure, not for idiopathic intracranial hypertension. So if a brain MRI shows that it is not a structural problem and you're not displaying like you have life-threatening meningitis or what have you, it's not worth that risk. It's the risk of a spinal leak, it's risk of infection to some degree, and it's the risk of having induced Chiari, where it sucks down the back part of the brain low, and one, it masks the high intracranial pressure, and two, it causes more problems. So we know as practitioners there is a trend not to do lumbar punctures for idiopathic intracranial hypertension. We don't need it. Okay, we can look at other things. We can look at the optic nerve. We can look at the size of the optic nerve sheath, ocular muscles. We can look at the pituitary gland on an MRI. We can look at quite a few things. And then ultimately signs and symptoms in response to treatment. And that's okay. Okay. But it's always secondary to inflammation if it's not structural, which means it is a temporary situation. And you don't want to do anything permanent that could cause permanent damage when you're dealing with a temporary situation. So that goes for lumbar punctures and brain shots. Okay. Alrighty. And there's a ton of information on IIH in the Driscoll theory. It's a ridiculous amount because no one had ever thought of abnormal intracranial pressure in patients before the Driscoll theory. It was the last thing people were thinking of. So I had something to prove, okay? And I will say we see more press on spinal leaks than we do on high pressure. Spinal leaks and high pressure pretty much present the same, but 99% of the time it's high. Fortunately, it's not a leak. Okay, so if you're trying to figure out which one's going on there, I would always start with high because you can't overcorrect high pressure and only save leak for the last resort. I have a lot of mold in my house. Could that be causing my POTS? Oh, think of mold or your Lyme or mycotoxins or all kinds of stuff like that as a trigger. If that's what got you sick, okay. But that isn't what is causing illness, because a lot of people can be exposed to mold or what have you, and they do fine. Instead, why is your body reacting so dramatically and that reaction persisting? Okay, so we always look at the patient first, not the trigger. Okay, is it smart to walk away from something if it's triggering you? Yeah, probably during recovery, but ultimately you can usually get back to those and be fine. So I think of an inflammatory state as it's better to not approach it as an avoidance situation. You start avoiding more and more. Gosh, I was down to 2 foods. Even those were problematic. Avoiding conversation, avoiding life itself. But rather than I would identify what the underlying problems are, treat that, and you can very gradually be exposed to those things and do just fine. Okay, so there's hope there. I think we talked about mast cell activation symptoms. Are those symptoms similar to POTS? There's a seminar. I did an interview for a mast cell activation summit. It's coming out in June. Please watch that. But what kind of the bottom line on that is there's a lot of mimickers, and look for abnormal tryptase. If your tryptase is abnormal, you need to know why. If it's not, you need to consider the mimickers. But mast cell symptoms they include sensitivities, rashes, hives, flushing, that sort of thing. Similar to POTS, it's similar to many inflammatory POTS. Mast cells are just one inflammatory cell, so yes. Are all POTS people inflammatory? That is such a good question. No, they're not. And it is important to pick that apart. In fact, someone here saw early on was the label of dysautonomia, not POTS. I think it's important to pick that apart. We pre-qualify the patients here. We want to make sure that it's really POTS. But the vast majority of patients reaching out to us are. We have seen cases, though, where it was not. Everything from a brain tumor. One of the most heart-wrenching ones was she presented with fast heart rate upon standing, but she didn't fit any of the patterns that we'd see in an inflammatory POTS patient. That something else is going on, and looked at her records. She was having an autoimmune response to a cancer medication. So, and ultimately it caused encephalitis. Had that been approached as inflammatory POTS, it would have been really, really, really horrible. So, no, not all POTS patients are inflammatory, but most we see end up falling in that bucket. And then, I'm reading these. How do you treat POTS without a diagnosis? Without a diagnosis, I'm not sure if without a diagnosis of POTS, if that means like without a tilt table test, that's probably the question. It's getting hard to find tilt tables anyway because doctors don't get reimbursed for it usually. But what we do is look for those patterns. In inflammatory POTS, we see a tendency for high pressure, a tendency for reactions, sensitivities, high anxiety, waves of depression, brain fog, vagus nerve problems, vascular issues, etc. We look for those patterns, and then when the patient is vertical, their heart rate goes up. We just don't look at it has to be 30 beats a minute. No, it doesn't. On a poor man's tilt table, when I was sick, my heart rate went up 19 beats a minute. And this one specialist in autonomic dysfunction said, "Oh, that's just a mild case of POTS. Just have a little salt, you'll be fine." I said, I am so sick. I can't do anything. I'm just relegated to the bed. And instead, my neurologist sent me for a tilt table, and my heart rate went up 60 beats a minute. But the heart rate was not what was making me so sick. It was head to toe. Ultimately, my body was being destroyed, and that was making me sick. So, let's see if there's anything. Oh, yeah, I'm sorry. I think I could spend all day talking to you guys. This is so great because we understand each other. I see that someone just told you to exercise more. What a narrow view of a very, very difficult condition. I think if we knew just a little exercise would pull us out of it, don't you think we would have figured that out and moved on? Or if we're mildly dehydrated, we need a Gatorade. Usually just have a Gatorade, you're good to go. We are so much sicker than that. I saw a lecture, or a talk by a terminally ill cancer patient. He died a couple weeks later. He was in a tuxedo, standing at a lectern, talking to the audience. I mean, he wasn't well, right? He was terminal. But I saw that and I said, he is so much more functional than a POTS patient. That's pretty sad. How is all of this getting missed? How are we not validated? For me, I felt like it was an emergency. And for my son, it was certainly an emergency. And no one was jumping up and down, screaming for us. So that's what my passion is to do that for us. Okay. In fact, the Patreon account, POTS Rebels, is all about just pushing back. We are going rogue here. We are doing nothing traditionally. We're going to help people from the underlying problem out. And if we are still told that it's deconditioning, need a little salt, it's psychiatric or whatever, we have made no forward progress with that. So we are leapfrogging all of that. So hang in there. I'm really happy to help you guys. So I hope this answered some questions for you. Look for some changes on POTS care. Okay, we'll have some more options for treatment. Someone asked about insurance. This is really tough. The only thing insurance will cover is traditional treatment. So we do finally have an ICD-10 code for POTS, but unless we're doing high salt, beta blockers, antidepressants, insurance will kick it back. So it's going to take years for everyone to understand some of this. We just can't wait for that. So it's why we're offering different levels of help. Meanwhile, at least let me get the book to you. For some people, that's enough to get them going. And then we'll continue to be in touch and let you know as we release more information. Hang in there. It was so great to see you. Thank you for joining us.